A later pregnancy loss, we think of more of a coagulation defect potentially, and that can happen in an early loss as well. But definitely we think of the coagulation piece in a loss that happens after 8 weeks. Recurrent pregnancy loss, it's a really hard topic. It's difficult to imagine somebody going through. It's difficult when it's yourself, like my husband and I have gone through. So, but very important to talk about to help us get to the other side. And I really admire women who try and try again, and after having a loss, because it's so painful and so scary and such a hard thing to go through. So I commend you, and I want to give a little bit of insight on why losses do occur. There's many pregnancy losses that we don't know what the cause is, unfortunately, and that's really hard. And a layer of stress to the couple's fertility journey, for sure, not knowing the cause of why did we have a loss. So looking at the potential causes when it's an early pregnancy loss, meaning within the first 8 weeks of pregnancy, we usually think of that as most likely a genetic cause for that loss. Sometimes we can test the fetal material and determine, oh yeah, there was Down syndrome or some type of genetic abnormality that likely was the reason for that loss. So that's what we think of in an early pregnancy loss. And a later pregnancy loss, we think of more of a coagulation defect potentially, and that can happen in an early loss as well. But definitely we think of the coagulation piece in a loss that happens after 8 weeks. So we want to look at factor V Liaison, we want to look at protein C and protein S, coagulation cascade of where things genetically inherited, and we also want to look at a person's history. So have they had a blood clot in the past? Is there a family history of pregnancy losses? Is there a family history of blood clots? Then we definitely want to dive deeper into some testing to see if there's any coagulation problems. And another thing to think about for pregnancy loss and after the 8-week time frame is there any anatomical problems? Is there problems with the form of their uterus? Is there problems with any fibroids that normally fibroids don't really cause any problems, but if they're situated in a certain place in the uterus, then it could potentially cause a problem as the baby grows. We also want to look at, is it a cervix? Is it an incompetent cervix? Was that the reason for the pregnancy loss? Helping to prevent pregnancy losses, absolutely. We can improve the health of both partners. So we want to maximize the health of the male and the female. That's going to help increase the sperm quality and the egg quality. And the higher quality egg and sperm we have, the less chances of a pregnancy loss, especially if that was contributing to the pregnancy loss to begin with. And then if we do come up with, in our research and testing, that a woman has a coagulation problem, then we can treat that. We can talk to their OBGYN about a low-dose aspirin, or is there a need for even higher anticoagulation or stronger anticoagulation, like a prescription-type medication. So a lot of times that can help prevent pregnancy loss. And also, depending on if it's an anatomical problem, can it be surgically corrected so that another loss doesn't happen in the future? Or if it's a cervix problem, then there is a way to help prevent another loss that way, and it's called putting in a cerclage. A cerclage is a stitch in a woman's cervix, and it holds together the cervix until close time to when the baby is due, and then that stitch is removed so that baby can safely stay inside the uterus until it's close to time for delivery.
If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.